What are the goals of mitral valve repair surgery? The ultimate goal here is valve durability. Can you fix the MR and improve the patient's symptoms 10 to 20 years or more? From the 2020 ACC/AHA Valvular Heart Disease Guidelines, mitral valve repair is recommended to replacement when the anatomic cause of MR is degenerative and a successful and durable repair is possible. Can we perform a durable repair? What are certain factors that a surgeon would consider to determine if a durable repair is possible or how to create this durable repair? Number one is, can they eliminate the mitral regurgitation long term? This is performed by restoring that leaflet coaptation length. The degree of overlap needs to be between 4 and 10 millimeters after the surgery. That is one of the big markers of long-term durability. 8 to 10 millimeters is even better. The surgeon will want to stabilize and remodel the annulus. That's why frequently rings or bands are used at the time of valvular surgery. The best repairs will be performed by maintaining normal leaflet motion. And there's some newer philosophies that involve respecting rather than resecting leaflet tissue in order to maintain this normal leaflet motion. And I'll get into a little bit more what exactly that means, that respect versus resecting tissue. Lastly, a surgeon will do everything they can to avoid new surgical complications. And these are avoiding SAM post-repair, iatrogenic mitral stenosis, LV dysfunction from a circumflex injury,